Welcome back guys. Now in this video let's discuss about different substances and their important absorptive sites. Now see here on this side I am actually showing you the important substances like iron, vitamin B9 and vitamin B12. Okay, iron, vitamin B9 and vitamin B12. So these substances are absorbed in which part of the intestine? See, iron is mainly absorbed in duodenum. Okay, iron is absorbed by duodenum. So where vitamin B9 is absorbed? Vitamin B9 is absorbed in jejunum. Okay, so jejunum. And vitamin B12, that's the 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞. Okay, 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞. It is absorbed in terminal ileum. Okay, so these are the substances and their important absorptive sites. See, this was the question which was recently asked in the exam. So there is this one tapeworm which is called as a fish tapeworm or Diphyllobothrium latum. Now this Diphyllobothrium latum, it lives where? An infection with this Diphyllobothrium latum will cause deficiency of which vitamin? See, this Diphyllobothrium latum or fish tapeworm, it lives in terminal ileum. Now what happens? It is living there and it causes inflammation over there, so that in terminal ileum absorption of the substances will be decreased. So who is absorbed in terminal ileum? In terminal ileum, it's a vitamin B12 which is absorbed. So vitamin B12 absorption decreases. Okay, so Diphyllobothrium latum, which is a fish tapeworm. This was the question asked. Okay, fish tapeworm is Diphyllobothrium latum. Okay, and where it's going to live? It's going to live in the terminal ileum. So it causes what? It causes vitamin B12 malabsorption. Now whenever vitamin B12 is decreased or whenever vitamin B12 levels decreases in the blood, it's going to definitely cause anemia. Which anemia it's going to cause? It's going to cause megaloblastic anemia. So this megaloblastic anemia due to B12 deficiency because of this Diphyllobothrium latum is called as Botryocephalus anemia. So Botryocephalus anemia is a type of megaloblastic anemia. Botryocephalus anemia is due to B12 deficiency. Okay, in Botryocephalus anemia, which part of the GIT is affected? It's the terminal ileum. Okay, it's a terminal ileum. Now, okay sir, well and good. Now after this, let's discuss about one more parasite which lives in the duodenum. Now the name of this parasite is called as Ankylostoma duodenale. Now this Ankylostoma duodenale, it lives in duodenum and causes inflammation in the duodenum. So what happens? The absorption in duodenum decreases. So absorption of with iron, okay, absorption of iron happens in duodenum. We have just discussed that iron is absorbed in duodenum. Now what happens? Iron absorption decreases. When iron is decreased, when iron absorption decreases, what happens? Anemia definitely. Okay, iron is needed for the production of hemoglobin, right? So whenever there is no iron, automatically hemoglobin synthesis decreases. That causes microcytic anemia. Okay, so Ankylostoma duodenale, it lives in the duodenum and cause iron deficiency. So that's going to cause iron deficiency anemia. Okay, it's going to cause iron deficiency anemia, which is microcytic anemia. Okay, where the mean corpuscular volume will be less than 80 femtoliters. So it's going to cause what? Microcytic anemia. Okay, microcytic anemias. Okay guys, now we have seen the important substances and their absorptive sites. Now after this, I just want to put some more important points here. See, iron deficiency is going to cause anemia. Okay, well and good. But what happens if there is iron excess? Okay, if iron excess is there in the body, that's going to cause a disease called as, anyone? Iron excess causes hemochromatosis. Hemochromatosis that causes bronze diabetes. Okay, simply overloaded state, iron overloaded state will cause hemochromatosis. Now as we are discussing about different substances like iron, copper excess will cause Wilson's disease. Okay, if there is more amount of copper in the body, copper accumulation in the body, that will cause Wilson's disease. Okay, Wilson's disease. So what happens if there is copper deficiency in the body? The copper deficiency is going to cause 𝗠𝐞𝐽𝐻 disease. Okay, 𝗠𝐞𝐽𝐻 disease. Okay. So copper excess will cause Wilson's disease and copper deficiency will cause 𝗠𝐞𝐽𝐻 disease. Iron deficiency will cause microcytic anemias and iron overloaded state will cause hemochromatosis. In the same way, some questions which were asked recently in the exam, selenium deficiency. Okay, selenium deficiency. Selenium deficiency is going to cause 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞 disease. Okay, selenium deficiency causes 𝐒𝐮𝐬𝐜𝐫𝐢𝐛𝐞 disease. And zinc deficiency. Okay, zinc deficiency. So zinc deficiency causes acrodermatitis Okay, acrodermatitis enteropathica. Okay, so it's not relevant now, but anyway I just want to integrate. Okay, so iron deficiency, copper deficiency, selenium deficiency, as well as the zinc deficiency. Okay, now after this let's discuss a bit more detail about the iron. Okay, let's discuss in detail about the iron. Normally, look at this image. Here I am showing you the enterocytes. All these are the enterocytes, and here is the lumen. Okay, this is the lumen, and these are the enterocytes. Now I am focusing you on the duodenum. Okay, these are the duodenal enterocytes. Why I am talking about the duodenum? Why? Because I have already taught you that iron is absorbed in the duodenum. See, now iron is coming. Okay, now iron is coming. Now usually the iron is in Fe3 plus form. Okay, Fe3 plus form. See, iron is in two forms. One is heme form, and the heme form of iron is readily absorbed. Okay, heme form of iron is readily absorbed. But there is this non-heme form of iron which is Fe3 plus. Okay, Fe3 plus. Now this Fe3 plus, it cannot be absorbed. Okay, this Fe3 plus, it cannot be absorbed. Now what you need to do? Now this Fe3 plus need to be converted into Fe2 plus. Okay, usually in most of the plant sources, in most of the vegetables, in most of the leafy vegetables and like all the vegetables, yeah, you are having iron, but it is in the Fe3 plus form. Okay, which is non-heme. So once if it is a non-heme, you cannot absorb it. So what you need to do is you need to convert the non-heme iron into heme iron. So that will be done with the help of acids, especially like HCl, and also the ascorbic acid, the vitamin C. Okay, ascorbic acid or any acids per se. Now usually acids will try to convert the non-heme iron into heme iron, by the help of acids. Now okay, now you are having iron in the lumen. This is the lumen, and you are having this iron which is in Fe2 plus form. Only this Fe2 plus form of iron can be absorbed. So duodenal enterocytes are absorbing this ion, metal, that's the iron. So with the help of a transporter which is called as a DMT1. Okay, please appreciate, here is a transporter which is called as DMT1. What is this DMT1? Divalent metal ion transporter. Okay, so this divalent metal ion transporter is going to help you to absorb the iron into the cell. Now once coming into the cell, now we want the iron in the blood. Okay, we want the iron in the blood, not in the duodenal enterocytes. So now this Fe2 plus form of iron, it should be transported to the blood. Okay, it should be transported to the blood. Now what will happen? Now you see this Fe2 plus, it's coming like this, and now what is happening? See, it's coming out of the duodenal enterocyte. Now with the help of a transporter called as ferroportin. So ferroportin moves. Okay, ferroportin moves the iron. Okay, ferroportin moves the iron into the blood. Okay, from the cell into the blood. But point here is, see this Fe2 plus again need to be converted back into the Fe3 plus. Okay, now the storage form of iron is not Fe2 plus. For the absorption purpose, you need to have Fe2 plus form of iron. But for storage purpose, you need to have Fe3 plus form of iron. That is ferric form, Fe3 plus form. So what happens to this Fe2 plus form of iron? It will be again converted back into the Fe3 plus form of iron with the help of hepastin. Okay, so hepastin is going to convert this Fe2 plus back to the Fe3. Okay, now this Fe3 plus is coming to the blood. Now important point is, you cannot just leave the iron just like that. Why? Because this iron will react with the water, so that Fenton reaction will happen. That will lead to the formation of the free radicals. Okay, that free radicals will cause a damage to the cells. Okay, so at the end of the day, what I am trying to put into your mind is this Fe3 plus form of iron. Okay, this Fe3 plus form of iron, we should not keep it. Okay, you should not keep it in its free form. Okay, you should not leave the iron in its free form. Why? Because that free form of iron will produce the free radicals. That's not something good. So in the blood, we need to take this iron and we need to bind it with the plasma protein. Okay, so that now it is binded. So what are these plasma proteins? Now these plasma proteins which are binding the iron are called as transferrin. Okay, transferrin. So transferrin is a plasma protein which is binding with the iron. Okay, which is binding with the iron. Now what happens? So now iron is there in the blood, but at the end of the day, we don't even want the iron to be in the blood. We want it in the storage site. Okay, we want the iron in a place where hemoglobin is getting synthesized. That's the bone marrow. So this iron which is there in the blood, it need to be transported to the bone marrow macrophages. Not only that, this iron need to be going into the liver. Liver is the storage site, and as well as the bone marrow macrophages are the storage sites. So now this iron which is bound with the transferrin, see, it is going to liver. That's a storage site. It will also go to the bone marrow. But once you have enough amount of iron, okay, once you have enough amount of iron, you should not take any further iron. Okay, that's something like basic. Why? Because see, once if iron enters into the body, there is no way this iron will leave the body. Okay, once it enters into the body, that's it. It won't go out. Okay, the only way to take out the iron from the body is like by shedding the cells. Okay, some cells which are shedding, some amount of iron is lost, but there is no particular mechanism to take the iron out of the body. So we need to be very much control. How much iron should go? We should be absolutely control. So whenever you have enough amount of iron in the liver or in the bone marrow macrophages. Now sufficient amount of iron will release the molecule called as hepcidin. So in the liver when you have sufficient amount of iron, now this hepcidin molecule is released. Now what this hepcidin molecule is doing? Now this hepcidin will inhibits the ferroportin 1. Or simply I can say, now when you have enough amount of iron, yes, hepcidin is produced. Now what is that hepcidin is doing? Hepcidin inhibits the iron absorption. Okay, saying like enough amount of iron is there is no need of further iron. So hepcidin what it will do? Negative feedback, something like kind of. Okay, so hepcidin inhibits the iron absorption. Okay guys, in this video we have seen important substances and their important sites, like sites where the absorption happens, and also we have seen some important points about the iron absorption. Hope the video is helpful. Thank you.